Hello, you are most welcome, ladies and gentlemen, to Tuesday Night Anatomy with Daniel Open. Today's section, I bring you one of the power behind the voice sections. My friends, this time around, I talk about the pharyngeal plexus. Now, there's something which bothers students a bit, and my friends, that is why it is my job as the noted anatomical prophet to demystify this concept for you. Yes, there are certain developments coming out as far as this concept is concerned, and that is why I'm going to take you through these things. And so, without much ado, let's set the ball rolling. My friends, the first thing is that we call this guy pharyngeal plexus. It's actually a nerve plexus, so it tells me that it is some kind of nerve plexus which is related to, of course, the wall of the pharynx. Now, if you say that, then you are not wrong. But my friends, precisely, we are interested in the constrictor muscles of the pharynx. And my friends, what are these constrictor muscles? We talk about superior constrictor, we talk about middle constrictor, and of course, we talk about the inferior pharyngeal constrictor muscle. Now, precisely, we are interested in, of course, the middle constrictor muscle. So, related to the posterolateral wall, okay, of these muscles, which I'm talking about, of course, the middle constrictor muscle mainly, we see what we call this pharyngeal plexus. And my friends, one thing that we know about this pharyngeal plexus is that there will be three main things contributing to it. Yes, I'll bring in a fourth component anyway. Now, what are these three main things? The first one is that there's going to be a sympathetic component to this nerve plexus. And what is this sympathetic component of this nerve plexus that I'm talking about, my friends? I am talking about the largest cervical ganglion. And my friends, that is, of course, the superior cervical ganglion, with, of course, contributions coming from, of course, C1, C2, C3, and C4. Okay, that is one thing I want you to become aware of. So that's, of course, the sympathetic component. Then we also have a sensory component. And my friends, that sensory component is coming from, of course, the ninth cranial nerve. And my friends, whenever we talk about the ninth cranial nerve, we are talking about the glossopharyngeal nerve. Okay, so that's a useful point that I want you to know. And then also, we don't only have, the sensory component, we also have a motor component. And my friend, this motor component is coming from, of course, the vagus nerve. And of course, when I talk about the vagus nerve, yes, mainly I'm talking about a pharyngeal, part of this vagus nerve that I'm talking about. But this vagus nerve, yes, running in the fibers of this vagus nerve will also be the cranial fibers of what we call the accessory nerve. And whenever we talk about accessory nerve, my friends, we are talking about, of course, the 11th cranial nerve. Okay, so these guys that I'm talking about together will be giving some kind of motor and sensory supply to, of course, yes, look at what we call the palate, and then also to, of course, the pharynx. Importantly, after all, we call it the pharyngeal plexus. Now, the main reason for doing this video is that oftentimes I see that some kind of nerves, okay, may do a lot, but the credit is not given to it. Okay, so by the end of this meeting, we will see, mainly what I'm talking about. Okay, and so without wasting my time, let's go through this and, of course, appreciate all that I need to tell you about this. Now, also one thing I want to also tell you is that sometimes there's something we call gag reflex or something we call pharyngeal reflex. And usually we ask you which nerves are involved. Okay, so mainly which nerves have I mentioned? I mentioned, of course, that of what we call the ninth nerve, that's the glossopharyngeal nerve, that's the most important nerve over there, together with, of course, the 10th cranial nerve. Okay, so these two nerves will be relevant as far as the gag reflex is concerned. Something true about these two nerves is that, okay, together, okay, with, of course, there's kind of common carotid artery and, of course, the internal carotid artery, they will find themselves in something called the carotid space, which is, within a sheet that we call it the carotid sheet. Okay, getting contribution from, of course, all the components of what we call the deep cervical fascia. Okay, that is one useful thing I want you to know. And so let's look at these things, okay, for appreciation of this concept. Now, the main reason why I decided to talk about this is that I am interested in telling you something about the extrinsic musculature of the tongue. Now, if you talk about the extrinsic muscles of the tongue, yes, together with the intrinsic muscles of the tongue, one thing that we are all aware is that by way of motor nerve supply, okay, it will be coming from what we call the 12th cranial nerve. And my friends, whenever we talk about a 12th cranial nerve, we are talking about the hypoglossal nerve. Okay, that is what we know about it, because whenever you talk about, one thing is that the intrinsic musculature, okay, of the tongue will ensure that you are able to, of course, change the shape of the tongue. But in changing the position of the tongue, we have 4 extrinsic muscles. And who are these muscles that we are talking about? Okay, we talk about this guy over here. Okay, this is actually the largest, okay, extrinsic muscle that we find over here. This fine shaped muscle that we find over here. Okay, taking attachment from what we call the superior genial tubercle, actually inserting in what we call the tongue, the substance of the tongue. One thing that we know is that this muscle is actually called the safety muscle of the tongue, because largely what we see is that the anterior 1/3 fibers, okay, will ensure that upon contraction, they will help in protrusion of the tongue, bringing the tongue, okay, out of the oral cavity, so that at the end of the day, you don't deglute your own tongue, you don't swallow your own tongue. So this muscle, which is of course the genioglossus muscle, okay, is the one doing that, playing that role over here. Of course, will be supplied by the hypoglossal nerve, no problem. Now, if I look at the middle fibers, okay, of the same genioglossus muscle, what I see is that it will be relevant, okay, in something we call retraction, bringing it backwards, retraction, okay, of what we call the tongue. And then, of course, the lower 1/3 fibers over here will be helping in depressing, okay, the tongue. Now, when you understand this biomechanics of musculature, you don't need to cramp some of these things. Because, my friends, if you look at the nature of the fibers, they should tell you, if it's insertion over here, it should tell you how the pull of the muscle. Remember that always, the most, the stable point is, of course, the point of origin, which you mentioned, that is the, of course, the genioglossus. And then, of course, the movable point, okay, that's the point of insertion. So look at it, the upper 1/3 fibers, okay, or the, let me say, if I talk about the anterior 1/3 fibers or the upper 1/3 fibers, they will be helping in, of course, protrusion of the tongue, so that you don't deglute your own tongue. And that is why we call this muscle the safety muscle of the tongue. Middle 1/3, helping in, of course, retraction, bringing it back. And of course, the lower 1/3 portion, helping it to depress it to a large extent. Okay, so that is what we see. Now, the other muscle, okay, extrinsic muscle of the tongue, okay, is this guy that we find over here. Okay, let me just take this one. Okay, so this guy that we find over here. Now, there's a stylo process, okay, to the substance of the tongue. So the name is, of course, styloglossus muscle. Also supplied by the hypoglossal nerve, no problem. Styloglossus muscle. Now, look at it. If this is the origin, okay, then what is going to happen is that it's going to pull it this way. So helping to elevate the tongue is by the concavity of this, guy we find over here, which is the styloglossus muscle. Yes, we are not done. There's a third muscle, okay, this quadrangular shaped muscle that we find over here. Okay, this guy over here, okay, there's the hyoid bone, and it's inserting over here, okay, in the substance of the tongue. So we will call it what? Hypoglossus muscle. And that is why upon contraction, this muscle will be relevant, of course, depressing, okay, the tongue, especially the posterior, portion of the tongue over here. Okay, so all these muscles I'm talking about, 3 of them, also, as I've mentioned, I've shown you over here, they are actually supplied by, of course, the hypoglossal nerve. Okay, now this is not a muscle, an extrinsic muscle of the tongue. Why? Because at the end of the day, yes, to the hyoid bone and also to the inferior genial tubercle. And so what is going to happen is that we are going to call it, geniohyoid muscle. Yes, together with what we call the, mylohyoid muscle will form the diaphragm oris. Okay, so that is not part of what we call the extrinsic muscle of the tongue. But my friends, the main reason for doing this is that if I come here, I will see another, extrinsic muscle of the tongue. And that's the 4th extrinsic muscle of the tongue. And my friend, that's that guy over here where it's highlighted, okay, in pink over here. This guy is what we call palatoglossus muscle. Yes, from, of course, the palate all the way to the tongue. So we call it palatoglossus. Anything glossus has to do with the tongue. So palatoglossus muscle. Now, looking at the orientation of this muscle fiber, then of course, upon contraction, it will cause elevation of what we call the tongue. So not only that we have, not only the styloglossus muscle is the one which is relevant in elevation of the tongue, but also the palatoglossus muscle. And I want you to appreciate that one over here. Now, my friends, one useful thing I want you to know is that this guy over here is not supplied by the hypoglossal nerve. And that's the useful thing I want you to know. And so I've seen often that we say that it's supplied by the vagus nerve, and my friends, it's wrong. Rather, the preferred answer I want you to give is that it's rather supplied by the pharyngeal plexus. And that's the main reason for doing this video. It's rather supplied by pharyngeal plexus. Now, some other authors, older textbooks will also talk about it, that it is supplied by, of course, the cranial accessory nerve via vagus. That's the interesting thing. It's supplied by the cranial accessory nerve via vagus, which means that, yes, actually, this muscle is actually supplied by, of course, the cranial accessory nerve, but through the vagus nerve. Yes, that is something I will be ending with. That is something we call hitchhiking of nerves. Now, something we can also call vagal accessory complex. Yes, because vagus nerve and, of course, the cranial accessory nerve, okay, doing it together. That's one thing I want you to know. Now, the interesting thing I want you to become aware now is that even the latest edition of a very renowned anatomy textbook is telling us that the cranial accessory fibers, okay, cranial fibers of the accessory nerve, yes, it doesn't exist. That's what they are trying to say. Well, it hasn't been proven and written in so many books, and so I'm not going by it. But if you are supposed to go by it, then it means that the vagal accessory complex will not hold, and therefore the vagus nerve may come into the picture. But even with that, I still want you to appreciate that this one is actually supplied by, of course, the pharyngeal plexus, and I'll be coming to these things. And so, what did I say about the pharyngeal plexus? Now, my friends, this is, of course, the superior constrictor muscle. Okay, now this is the pharynx. Okay, so at the posterior aspect, we have what we call this superior constrictor muscle. Then we have what we call the middle, and then, of course, we have the inferior pharyngeal constrictor muscle over here. Now, what did I say? I said that on either side, on the posterolateral wall, okay, of the pharynx, precisely where I'm talking about the middle constrictor muscle, we see situated over here, we see what we call the pharyngeal plexus. Okay, so that is one useful thing I want you to become aware of. And so, what are the components of this pharyngeal plexus that I'm talking about here? I mentioned it to you. I mentioned one of them to you that, yes, I'll be talking about, a ganglion. I'll be coming to it, that's superior cervical ganglion. Okay, I'll be coming to that one. But apart from that, I told you that one is actually sympathetic component. Then I also told you that there will be a sensory component. And that sensory component is the one I told you. Okay, the cranial nerve 9, the glossopharyngeal nerve. Don't forget that the glossopharyngeal nerve, yes, it's not only going to supply some regions of the palate, okay, mainly the soft palate, and of course, the pharynx, but of course, also, I tell you that it will be supplying the posterior 1/3 portion of the tongue, giving, carrying both what we call general sensation and special sensation by way of taste. That's gustation, okay, from the posterior 1/3 portion of the tongue. Okay, so that's that guy over here. And you can see having these two superior and inferior, ganglionic swellings over here. Then also, I also told you that there will be another nerve, and of course, that nerve is, of course, what we call the vagus nerve. Now, remember that the vagus nerve is the most wandering nerve that we have in the human body, okay, moving everywhere, supplying, giving motor supply, giving sensory supply. But remember that this time around, I am interested in the part which is, of course, motor component, contributing to this, of course, the pharyngeal plexus over here. Yes, it will also be having two swellings. I'll be showing you better in there. Okay, to be having a jugular, ganglion, and of course, it will be having that kind of nodus, okay, ganglion. I'll be showing you that one. And then also, there is also a useful thing, which let me mention it now. Can you see that we also have that, of course, the 9th, okay, cranial nerve over here, which is, of course, we talk about the accessory nerve. And I'm interested in the cranial portion, if it exists. Then, usually the cranial portion, yes, immediately after exiting via what we call the jugular foramen, it will join what we call this, vagus nerve. So that both of them, they are motor. Okay, so that becomes the motor component of what we call the pharyngeal, plexus. Okay, so now that's one thing I want you to know. Now remember that the most movable, okay, as far as the neck is concerned, the most movable joint that we have is, of course, the atlanto, okay, axial joint, atlanto-axial joint. So you can see the C1, okay, that's, of course, your atlas, and of course your C2 is your axis, okay, helping that kind of rotatory movement over there. Now, one thing, because it's so mobile, then one thing is that one point I want you to know is that the vagus nerve, okay, then of course the glossopharyngeal nerve, yes, they will be running, okay, in front, okay, of what we call the transverse processes of C1 and C2. Okay, yes, C1 may not really have, maybe having the lateral masses, okay, to be running, okay, I mean, in front of these areas. And because this area is so movable, yes, these nerves are viable, okay, are liable to what we call injury. They are susceptible to injury. Okay, so I want you to appreciate that. And that is why I'm saying that sometimes, another useful point I want you to know, which I'll be showing you better in the next picture, one useful thing I want you to become aware is that sometimes there could be compression, okay, of these structures I'm talking about. And also, when that happens, then what will happen is that in case there's that kind of compromise, okay, regarding the blood supply, okay, to the, the head and neck, mainly to the brain, okay, for instance, through what we call the cranial cavity, okay, mainly through what we call the internal carotid artery, it could be compromised, okay. And so one thing I want you to know is that what usually when such a situation arises, okay, where the nerve, what we call the blood supply to, of course, the head and neck region, okay, becomes reduced. And at what point will it become reduced? That is when sympathetic stimulation, okay, overtakes that of the parasympathetic. Because we know that sympathetic, okay, stimulation will ensure that there will be that kind of vasoconstriction. So if there's vasoconstriction, then the blood pressure will be so high, okay, we need to send blood to this area too. And in such a situation, what is going to happen? Then we need that kind of parasympathetic component, okay? And we know that the vagus nerve is a parasympathetic nerve, and that is why it will inhibit, okay, the sympathetic activity over here of, the superior cervical ganglion to ensure smooth flow of blood to, of course, the head and neck area. And so that is one thing I want you to know. And that is why, yes, I told you that the vagus nerve, it will be having two ganglion swellings over here. And that's the one I said around the jugular region. I talked about what we call the jugular ganglion. And I also talked about the nodus ganglion. Okay, please appreciate these ones. And so talking about the other component, which I need to spend a little bit time on, that is the superior cervical ganglion. Now remember, we have three cervical ganglia. Now, whenever we talk about ganglia, then we are talking about collection of cell bodies, okay, outside the CNS. Okay, so we are talking about collection of cell bodies in the peripheral nervous system. Now, the first guy is found over here. Okay, you can see just right in front of what we call the C1 atlas. Okay, this guy is the one we are calling the superior cervical ganglion. Superior cervical ganglion. Now, I told you, the contributions will be coming from, of course, C1, C2, C3, and of course C4. And that is why the superior cervical ganglion is the largest cervical ganglion. Okay, so that is one thing I want you to know. Yes, true, of course, the sympathetic trunk, okay, connecting them, there will be another one below over here. I'll be coming to this one again. We'll be having what we call the middle cervical ganglion. So middle cervical ganglion, yes, the root value will be C5, C6. And that is why also it is the smallest ganglion that we are going to have, the middle cervical ganglion. Okay, and then finally, okay, one thing I want you to know, which yes, it is star-shaped, and that is why we may also call it the stellate ganglion. That is, of course, the inferior cervical ganglion. Okay, stellate ganglion. Okay, and that guy will be having contributions from, of course, C7, C8, and of course, T1. Okay, now I am interested in, of course, the superior cervical ganglion because that's the one where it's contributing to what we call the, pharyngeal plexus. And so look at this. So that's what I was talking about. Now, through the superior cervical ganglion, that fibers, okay, will be reaching what we call the internal carotid artery. So in such a situation, then of course, there will be, if this one dominates, then there will be vasoconstriction. Okay, now we want an equilibrium, a state of balance, such that yes, the vagus nerve is supposed to supply it, and so that yes, the blood vessel is not that fully, it's not completely dilated, it's not also excessively constricted. It's a normal situation. But in such a situation where, okay, the blood supply to the head and neck region, okay, is compromised, then one thing that is going to happen is that then there will be overstimulation of the vagus nerve, ensuring that it inhibits, okay, the fibers coming from, of course, the superior cervical ganglion. So that doesn't, constrict the blood vessel, rather causes vasodilation, ensuring more blood to the head and neck region. And so, my friends, finally, that is what I want you to know about. There's something we call hitchhiking of nerves. Although, yes, this renowned book I'm talking about is trying to say that the cranial accessory fibers is not really there, and they want to rather qualify, okay, the spinal accessory nerve, okay, to be the real accessory nerve, okay, so they call it accessory nerve proper. But yes, regardless, yes, until we see a lot of research, okay, debunking the existence of the cranial accessory fibers, okay, cranial fibers of the accessory nerve, then what will happen is we still go on with these concepts. And so one thing I want you to know, if you pay attention over here, now you can see, now this is my vagus nerve, okay, the 10th cranial nerve coming out. Then I also have what we call the cranial nerve 11, okay, that's the cranial fibers of it, and then the spinal fibers together, okay, that's why we put them together, forming what we call the accessory nerve. Yes, we know that the spinal fibers will be going down, yes, supplying two main muscles which are important as far as the boundaries, okay, of what we call the posterior triangle of the neck is concerned, talking about, of course, the trapezius muscle, and of course, talking about the sternocleidomastoid muscle, going to supply these ones, giving motor supply to these ones. But my friends, I'm talking about the cranial fibers of the accessory nerve. So that what will happen is that immediately after coming out through what we call the jugular foramen, it joins, okay, the vagus nerve. And this is something we call hitchhiking of nerves. So it means that actually the palate and of course the pharynx, the muscles over there, they are also supplied by what we call the cranial accessory fibers, okay, cranial fibers of the accessory nerve, and not by the vagus nerve. Vagus nerve mainly will be supplying what we call the laryngeal muscles, okay. But yes, still the credit is often given to the vagus nerve. Why? Because this cranial accessory nerve, okay, used the cranial nerve 10 by way of the vagus nerve to reach the destination, supplying these muscles, okay. So that is one thing I want you to know. So I'm sure you've really understood this concept by way of the pharyngeal plexus, the components, and also understood the hitchhiking of nerves, and also understood why. Rather, it is better for us to say that yes, the palotoglis muscle is supplied but for the cranial accessory nerve via vagus or the vagal accessory complex. Or better still, let us talk about the pharyngeal plexus. My friends, I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.